Okay. Good evening. This is the program implementation and evaluation for spring 2021. Our group is doing the Charleston County Teen Pregnancy Prevention Intervention. My name is Alexa Fontana Maroney. My group members include Jeremy Fluton, Christina Stepanova, Lauren Jewel Florence.
Charleston County's demographics. Within Charleston County, there are 411,406 residents, broken between 48% that are male and 52% that are female. The median age for Charleston County is 38.2, with 19.7% being under the age of 18 and 16.4% being over the age of 65. In terms of race and ethnicity, 64.4% are white, 26.4% are Black, and 5.1% are Hispanic. In terms of being uninsured, in Charleston County, there are 16% of Charleston County that are uninsured compared to only 7% of the top U.S. performers. But of that 16% of Charleston County, children make up 6% of it. In terms of education, Charleston County has 85% graduation rate for high school compared to only 96% of the top U.S. performers. In terms of below the poverty, in Charleston County, 20% live below the poverty line compared to only 11% of the top U.S. performers. County health status. The number of teen births is 18 per 1,000 compared to the top U.S. performers at 13 per 1,000 for females ages 15 through 19. There is a substantial difference in the birth rates of teen mothers by race. The birth rates are as follows. For Hispanic teens between the ages of 15 through 19, 52 per 1,000. Black teens is 31 per 1,000, and for white teens, it's 7 per 1,000. The percentage of children under the age of 19 without health insurance makes up 6% of the county's population, compared to the top U.S. performers of 3%. The healthcare workforce. Approximately 67,479 people are on Medicaid in Charleston County. For the South Carolina Medicaid branch, South Carolina Health Connections, Medicaid provides coverage to pregnant women with low income and continues for the mother 60 days after the baby's birth. The infant maintains health insurance to the age of 1 under the same plan. Teen pregnancies are at higher risk of adverse health outcomes, including neonatal and infant mortality. The infant mortality rate in Charleston County is 2.2% in white residents compared to only 10.8% to 10.8% in Black residents, a substantial difference by race.
Concluding our health needs assessment, program identification. Due to the significant disparities in pregnancy and infant mortality rates within teen minority populations, Hispanic and Black, this plan will address females aged 15 to 19 with an educational focus on reducing teen pregnancy.
For the target population, we will be targeting teen girls ages between 15 and 19 who are not pregnant, with specific focus on minorities in the Hispanic and Black populations in Charleston County. The zip codes will include 29405, 29406, and 29418, present large minority populations ideal for implementing this program. As we progress through year 1, we can look to expand into other areas with similar needs.
Health behavior theory. Since the program's primary goal is to prevent teen pregnancy through education and awareness, the health belief model is the most appropriate theory for a program, and the one we chose. The studies showed that the health belief model has been successful in educational interventions about teen pregnancy. The key construct of the health belief model are perceived susceptibility. By presenting the teen pregnancy rate statistics and data, we will show teens that sexually active teens are at high risk of getting pregnant. To address perceived severity, we will touch on the high rates of high school dropouts, negative economic impacts, limited employment opportunities, lower birth rate, and infant mortality. Perception of benefits, we found that the biggest benefit is that contraceptive prevent teen pregnancy. Perception of barriers, the main barriers are the lack of education about sexual activity and access to contraceptives, as well as difficult discussing contraception with the parents. Cues to action here through community partnerships. Awareness events and public outreach information about preventing teen pregnancy will be distributed. And lastly, self-advocacy. To address self-advocacy, educational tools like the landing page and the flyers will allow those who are seeking information regarding contraceptives make educated decisions.
Our community partners are as follows. Better Health, who has partnered with the New Morning Education, provides free and low-cost birth control. Fact Forward for spreading awareness and conducting research and evaluation to prevent teen pregnancy in South Carolina since the year 1994. Iglesias Ni Cristo Church of Christ, the Spanish Church in the zip code 29405, and North Charleston Spanish Seventh-day Adventist in zip code 29418.
As our program planning budget, we will emphasize the online resources and the community outreach events in our budget as the two main sources of our spending. Ideally, our budget will be supplemented by volunteer efforts and community donations, but our initial costs will be about $4,950, and total estimated funding over our 3-year period is $45,125.
The goal number 1 for our program is to decrease teen pregnancy and birth rates among the African American population in Charleston County. And the SMART objective for the goal number 1 is to decrease teen pregnancy rates in zip codes 29405, 29406, and 29418 from 31 per 1,000 females to 28 in 1 year, and from 28 per 1,000 females to 24 in 3 years through targeted social media campaign.
Our second program goal is to decrease teen pregnancy and birth rates among the Hispanic population in Charleston County. Our SMART objective is to decrease teen pregnancy rates in zip codes 29405, 29406, and 29418 from 52 per 1,000 females to 45 in 1 year, and 45 per 1,000 females to 32 over 3 years through community social events and local gatherings.
The first activity for our program will include social media campaign using geographic and demographic targeting, focusing on zip codes, gender, and age. It will address teen pregnancy and its negative impacts. By clicking the promotion on Facebook or Instagram or other social media platform, the teen will be taken to the landing page that will be created. That landing page will have information about birth control, teen-friendly medical providers, and other tools to help build their confidence and knowledge. So while the teens are on the landing page, we will ask them to fill out a pre-survey and offer a $25 Starbucks gift card incentive, collect their email, and then get a permission to email them in the future. And the goal of this activity is to make pregnancy prevention information easily accessible and encourage African American teenagers to utilize the resources that are available for them in the community.
Our second program activity is an online community event calendar that will promote family and teen programs and activities within the community, as well as volunteers and supervisors attending those events and local activities with the opportunity to set up a booth or a table so that they can pass out flyers and the print materials, as well as links to online resources to engage the population, the target population, in communicating with family, asking questions, and identifying resources for contraception and safe sex practices. Materials will be available in Spanish and English for these activities, as well as implementing the social media campaign. Our program Gantt chart is divided into 3 different categories: preliminary planning, current program, and the program extension. Under 4 different leaders: the content manager, the volunteer supervisor, the community outreach coordinator, and our program coordinator. Emphasizing different quarters over a 3-year period, we'll be able to continually assess feedback from the community and whether or not we're meeting our program objectives.
For our facilitators, the content manager will supervise the webpage, online resources, flyers, and printed materials to ensure language is not a barrier to information and ensure the most accurate and up-to-date information is available. The volunteer supervisor is responsible for recruiting and training volunteers, scheduling workers for local and hosted events, and supervising volunteers during the events. The community outreach coordinator is responsible for obtaining community sponsors and funding, finding local venues, and providing open communication between the program and community. The program coordinator will oversee assignments and evaluations, community resource requests, additional community outreach, and determine sources/location of program expansions. Barriers, biases of our community partners' political and spiritual beliefs in contrast to programs' goals, funding, extending budget and acquiring funds to meet the needs of a 3-year public program, privacy violation and working with teens regarding sensitive social topics. Additional considerations must be taken to protect privacy while addressing individual concerns. Parents, family, and peers' influence can negatively affect involvement of targeted teen population. To overcome these barriers, the community partner biases, we would sit down with our community partners and review our program's methods. For funding, we would provide up-to-date budget expectations and continually seek out additional community partners to implement strategies to remove or lessen the costs. Privacy violations. Privacy is our top priority for this program. With that, we will ensure that we limit the amount of identification information being requested. Parents and family and peers. We will invite parents and family to the planning committee for this intervention and will provide the community with education as it relates to teen pregnancy and its negative outcomes.
To improve program effectiveness, efficiency, and cost effectiveness, the outcome evaluation method was chosen. The information obtained from the outcome evaluation can help generate data on the program's success and to what degree those outcomes are attributable to our program. Using the outcome evaluation, we may address questions such as whether teenagers feel more comfortable talking or asking questions about contraceptives. Were they more likely to use contraceptives after learning more about the different types, or are they more aware of the risk factors? For program evaluation data, we chose to use the survey. During the time on the landing page until we'll be asked to complete a survey, question about ethnicity will be included in pre-surveys and will allow us to assess 2 populations and sort of put them in different buckets. The survey will be used to indicate how African American and Hispanic teenagers view pregnancy as adolescents. And in this step, we will collect emails and also get an email permission for the post-survey. Now in post-survey, will be conducted using the same questions. The survey will be used to measure effectiveness of the program, and we will be able to compare the pre and post surveys. Surveys will be evaluated to indicate if the program has given the African American and Hispanic teenagers the confidence and knowledge to prevent teen pregnancy. And in addition to the social media email survey of the Hispanic population, we'll also do a in-person survey during one of our community events.
The lessons learned are, in order to develop an intervention program, a community health needs assessment must be conducted to determine the needs of the community. Understand the community and the resources that can be utilized as part of the program, either its research of data or community partners, are essential and make the outcomes viable. Teamwork, the facilitators, and other implementing the program are essential for success. Approaching each community based on their needs for a sociological standpoint is essential in order to make a meaningful connection and potential change. To future cohorts, trust the process and don't get overwhelmed. It will all come together in the end. Read the guidelines for the project in its entirety before starting, and that concludes our project.
Thanks, everyone.
Yep.